Thanks for that, and I appreciate it. So we're gonna have to move on to the case presentation at this point, but I do want to say if others have ideas or tools that they're using or resources, please share them in the chat. We copy the chat and we'll include them in the notes that we send out to everybody. So thank you so much. And now we're gonna turn to our friends in Vermont. And I think Jennifer Fitzgerald, you're gonna be the case presenter this morning.
Yep, I'm just trying. Oh, am I on now?
You are. We hear you.
Okay. So my case involves a 75-year-old female whose longtime friend came to visit her about a year ago and discovered that a previous history of hoarding had escalated, and so she wanted to help her get her needs met. She had no running water, no heat, no electricity. And this was in late February, early March last year. So she set to work on how to do that. And that is what raised my primary questions. Should that be done now or after I tell all the history?
I think, why don't you go ahead and tell the history and then ask the questions.
Okay. So as the client's denial increased regarding her dementia and hoarding, it was affecting her health, her ability to face mounting debts from unpaid bills mostly, and contributed to her isolation and withdrawal from reality. Her known history of alcohol misuse and forgetting to take her meds was also a problem. So Carlotta, who is participating today, will answer a lot of the questions that may come up. Had a really difficult time even finding words for what she saw at that home. It was more than just collecting a lot of papers or clothes or unopened mail, but it was also uneaten food or moldy food, or because the refrigerator wasn't functioning and the stove wasn't working. The odor was terrific. And then after all of that, she discovered 2 cats in the home that had been littering indoors. And the patient would feed the cats before she'd remember to feed herself. So the patient had limited transportation because she had voluntarily given up driving the previous year. But she would often call friends to take her shopping or for doctor's appointments. But sometimes, she gave the wrong date or she wasn't ready when they came. So Carlotta was able to keep her organized with that and would stay with her on all the appointments to share, what she was seeing in her friend. As for family history, the client was born in France when her parents left Poland during World War II. And it is known that there was a family history of mental illness as well as dementia. The client's family later moved to the United States, settling in Queens, New York, when the client was 11. The client moved to the Deerfield Valley in the early 80s and purchased a property that included a retail building and an adjacent house with 4 attached apartments, which would help her obtain rental income so that she could open a ski shop in 1985. In the 90s, the client researched adopting a child, and in 1999 actually went to Russia to adopt an 8-year-old girl who essentially presented with severe mental and developmental challenges. And yet the client brought her home to the United States to provide care and try and integrate her into the community. But that relationship often had volatile occasions of verbal and physical abuse in spite of, their best intentions. And the client's friends were always supportive to her as well as the adopted daughter. So the client, let's see, the issues that have been resolved so far is that with Carlotta's help, the client, she was able to organize the services that the client was receiving. And there was one agency that was considering filing for emergency guardianship, but Carlotta decided she wanted to become her guardian. And after being appointed temporarily, she was able to secure supervised housing with the help of various agencies, and the client could then transition to an assisted living facility, which is where she is today. The client's home and business in Vermont have been sold to pay off her debts first, and then the remaining assets have been put into a trust for the client to remain in this assisted living. It was accomplished primarily because of Carlotta's really pushy way of getting the resources and the help that she needed to find her friend a safe, healthy place to be. I feel this is an opportunity for us to understand some of the stressors raised by this individual case, and to thank not only Carlotta but my colleagues in the service providers that helped make this a reality. So the primary questions now I have a little more information, I'm sorry. There were incidents involving first responders, which primarily were to intervene in altercations with tenants over non-payment of rent, the tenants doing work for the client that she'd bartered for, but then overlooked or forgot what they'd done. Incidents with fire or alarms going off in the client's home or primarily the rental properties, and situations involving verbal or physical abuse within the family or the tenants or contractors that had not been paid. And the current service providers were the Deerfield Valley Health Center, where she had a primary care physician, Senior Solutions, who offered multiple programs that Carlotta was able to tap into and that the client was already receiving, including Meals on Wheels and I think transportation to the meal site. She also had church support, services from HCRS, which is the mental health provider for our area, not only, well, primarily for the daughter. And Twice Blessed is a thrift store that donates, holds the money to pay for people's fuel assistance at least one time if there's an emergency, and after making sure that they're connected to the service providers in the state that, you know, may offer that as she might qualify for. And the Mover is our local transportation provider that has scheduled routes in the valley, but also has contracted ability to pick people up to bring them to the meal site or the gathering place, which opened an adult day program in Wilmington. Families First, who were providers of people under 23 that had multiple disabilities or developmental needs. And then finally, Brookdale at Fillmore Pond is the residence that took her in lieu of the potential sale of the building. And even after a crisis situation, after they had to lock down the building because of illness, they looked at Carlotta looked at an inpatient dementia unit that would take her, but they were waiting for a single room because the patient really has difficulty not having her own space. And it's all been resolved now that the crisis is over and she can stay where she is. So the questions that I came up with in this process were, how can agencies coordinate services if a client has not given permission for them to collaborate? That was a barrier at first because nobody knew Carlotta, and the client herself wasn't willing to let her express her views of what was going on. How can non-medical or professional caregivers glean information that might help them better meet the client's needs? So often, if Carlotta wasn't with her at an appointment, information that might impact their treatment options was finally elicited. Are there opportunities for an intervention if relatives, friends, community members, or agencies report self-neglect concerns? And what I mean is several different groups of people did report self-neglect, but I'm not remembering the phrase that's used for patient self-determination. But, if she was refusing services, she was respected and not offered the help that other people might think she needs. So is the lengthy process of applying for temporary or state guardianship the only option left for people that have concerns and don't have the skills that our didactic presentation gave us today?
Yes, yes, that's Cinda's definitely, it's a practice that we have to,
Oh, I'd love to see that.
We're all aspiring to, right?
Absolutely,
So anyway,
absolutely.
well,
Yep.
thank you, Jennifer, for that. And certainly this case brings up, and it's thankful that it's resolved, and that Carlotta, who is with us today, was able to be such an incredible and effective advocate in this situation. Unfortunately, for far too many people, they don't have that sort of advocate. And so I think particularly as we're thinking through recommendations at the end of this conversation, offering those a little bit more globally for people who are living alone and or who don't have family members who have that sort of advocacy capability, sort of the kinds of supports we can put in place in those situations, and certainly complicated by the idea that she had a rental property with renters still in the property. So I'm going to open it up now, as we do, for clarifying questions. So just clarifying questions, and just from our spokes cohort, so from our communities. So who has a clarifying question that they would like to ask?
And remember, most of you are muted, so you'll press *6 to unmute, or unmute the button on your mic on the computer.
I have a question.
Okay,
Can you hear me?
we can.
I'm wondering how the person handled Carlotta coming in, that the woman or the man left their home, and all the steps thereafter. What kind of resistance was there, and how did Carlotta handle that? Because that's always so challenging.
Can you hear me?
We can.
Okay, this is Carlotta. Yes, at first, my friend was in denial that she needed help, that her house smelled so bad. I needed an N95 mask to go in there, and the place was clean. So I had to firstly get over that hurdle, and that was the main thrust of the need for her to get out of these deplorable living conditions. between not having electricity, plumbing, heat, water, flushing toilets, and the cats, the smell, and to try to, my first goal was to remove the cats because there was cat food, dried up cat food all over various dishes, piled mountains high on top of the stove or whatever. So that was my first goal, and to try to have her be in a different room, or I tried to have a mutual friend and or her realtor take her out for lunch while I kind of got through, and I ended up throwing out about, I think it was 68 giant green garbage bags, and it hardly looked like it was a dent made, almost to the fact of when you watch, if you ever do those hoarding shows. So I had to try to gain her trust through all of this, and it took a lot of effort. I took her to my house so that she could take a shower, and which she refused to do and still does. And when she kept coming back to her house, I was hoping that at some point it would sink in that this was unhealthy situation, and it did finally, but it took a while. But her resistance and denial of needing help from anybody was the big hurdle. She gained my trust, and that's how we were able to move forward and also when I took her to the doctors, I took her to a memory clinic that she had been to before for a maybe fourth evaluation, and they, acknowledged to her that she had Alzheimer's, and just trying to repeat many times the situation, which she couldn't remember, but the visuals are, sometimes are the way people interpret and can understand and can communicate. So I kept trying to point out to her the various things in her house that we needed to get. That's why we needed to get her out of there and get some help.
Other clarifying questions?
Was Adult Protective Services called at any time?
Yes, every month the agency got the report, and the notification would come back every month, the same thing, that they didn't see that this was a dire need of stepping in. And I don't know what, and Jennifer we were trying to think, and I don't have my files. I'm actually in New York City, hunkered down here. So I don't have my files, but I can't remember what the term was, but there's a term that it's almost, you can live in a pup tent if you want to, and nobody can force you to leave. And that was the barrier that all the agencies had, that if that's the way she chose to live, we couldn't force her to leave. The one thing we were able to do is that the town was able to condemn the rental property because the tenants had no, services, utilities either. So that you can condemn, but because I went to the town and no, they couldn't condemn private property. They can condemn retail property and also rental property, but not personal property.
Other questions from our spokes?
Oh yeah, Carlotta, do you still have contact with her?
Yes, I just spoke with her yesterday. She luckily, as we presented, that she was able to sell her property, and which she still doesn't kind of remember that. She still asks about it a lot. She sort of knows that it's sold, but what happened to her things inside the house and what happened to her belongings, and which before she moved, I did remove some personal things for her to hang on the walls, and so some pictures and all that. So she has relented to the fact that this is her new home, the assisted living place, but it still hasn't sunk in that her other home is her real home is in shop has been sold. She admitted yesterday that she's actually happy there, but that comes and goes given her up and down stages of her awareness of things.
Right.
Thank you.
Yeah.
So now I'm going to move to clarifying questions from faculty. And certainly if there's others from spokes, feel free, but I'll open it up to our faculty now.
Was it an emergent? Was the temporary guardianship, was that a voluntary? Did she agree to it, or was it involuntary?
It was involuntary.
Thank you.
Can you give a sense of the time period that this all happened over, from the time that Carlotta, you decided that she should not be living there, to when she went to assisted living?
She had been a hoarder for maybe 7 years, and it just got out of control. I'd say in maybe February, March, and of course then when she had no heat, and she had burst water pipes and plumbing issues that had been the emergency repairs were made. Of course, the bills never were paid, but that had started in the late winter, and then in the spring is when I think it was maybe April, I stepped in and said, we've got to get you some help, services. She had filled out forms through the different agencies, but they never were sent in, or she didn't sign them, and then she refused to sign them. So she hadn't gotten, of course, there was no fuel assistance to get, but food stamps or any kind of extra help. I ended up driving her myself to the Medicaid office and to fill out the forms once she gained my trust, and I said that she needed this help. So that was in the early summer. I met with the guardianship person from Montpelier who drove down and interviewed me, helped me fill out the forms. I believe it was in July. She also met with my friend in her hoarding situation, interviewed her, and then I think it was in September or August, I guess it was August. I'm looking at the guardianship papers here. August was the actual filing of the involuntary guardianship. I was also told through the guardianship individual that there's a very long list of guardianship needs through the state, and not enough people who can act as state guardians, and that there are a lot of very big emergency type of needs. So that's when I knew my friend would not listen to a state guardian, and that she would, because there were very other complicated issues. But so I stepped in. So it was August that I had control, sort of like, I want to say, ability to step in, because if you can't do a lot without having that paper, that guardianship paper or power of attorney, because of HIPAA, laws, and if you're starting to it suggests that somebody needs to go into a nursing home or whatever facility, somebody has to sign off on that, and you have to have a guardianship. So that was an important piece.
Thank you. We have a couple of minutes for one more question. One more clarifying question.
This is Laura Davey in New Hampshire. I was wondering if there were any, her primary care, and I'm sorry if I missed it earlier, were any medical folks on the medical side of the house involved in her care, or did she talk with any of them?
Yes, yeah, that had been ongoing, and I was given permission by my friend to go to those medical primary care meetings. And the social worker was also involved. I spoke with her, and she's the one that actually tried to explain to her that she had Alzheimer's again. But yes, and they had to provide documentation for the guardianship. It was quite involved. The state had to do a state evaluation through the nurse who came to interview her and me, and I have like a 10-page document of the evaluation that we came to the conclusion that yes, she needed to have a guardian.
Thank you for those clarifying questions. And now we will move to recommendations. As we do, we'll start again with the folks in the community, the spokes community. And just as a reminder, in a global sense, the questions are: what are the best opportunities for an intervention when there are reports of self-neglect concerns, and how can community resources best collaborate when there isn't specific consent for information being shared? And then finally, are there other less timely and challenging alternatives, as Carlotta just described, to guardianship that we could be considering in cases like this? Go ahead with recommendations from our spokes.
Again, this is, we had a situation similar to this in the North Conway area, and something that happened in the small town that this particular person was living in. The town fathers and the town manager was able to go into the home and declare that it wasn't safe for the town to go into if there was an emergency, like fire or ambulance. So that was an angle that they were able to take that seemed like it could have been helpful here.
Terrific. I know that we've used that similarly in Maine. Additional recommendations?
Yeah, I think another recommendation would be, and I know this was probably an effort was made, but I think getting the medical people who knew her willing to confirm that she didn't have capacity, because it sounds like you tried to get Adult Protective Services and they somehow believed she had capacity, but she clearly didn't have capacity. And so that's an ongoing problem in different states, and different adult protective organizations have a different level of tolerance on that. But really, I think doing that early on is really key, so that then you can get the guardianship going more quickly.
I could be mistaken, but I don't think that Adult Protective Services has the legal capacity to declare somebody incompetent. Don't the courts have to do that?
Yeah, but yes, the answer to that is that's correct, but they kept dismissing it because they said she had capacity to make decisions. And so they kept I mean, it's a vicious cycle, right? I mean, they're dismissing the effort to try to get help in there because they say, oh, she's allowed to make her own decisions. And so that judgment of capacity early on, I think, is really helpful, or incapacity. And that requires medical professionals. That requires somebody, in the medical world making that.
Right, they have to bring the evidence before the judge that the person is incompetent. So that has to be done very early on, or basically all the state organizations are pretty helpless.
They always threw out the fact that unless there was self-harm, and I guess you have to determine what the back meaning of those words are, that they couldn't be could be forced out.
Having a physician make a house call would solve that.
Mm-hmm.
So that's going to be a recommendation, yes, Leslie, having a physician make a house call.
Yes.
Other recommendations from our spokes communities? I did not mean to hit that button. Okay, I'll assume your silence means there's no more recommendations. So we'll move to our faculty. Mary Val?
Well, I have to say, Carlotta, that I felt for you in this situation because I too have had other friends and neighbors report kind of a similar thing. And a lot of times the anguish that they had was so palpable. You know, it was, they were reaching out, trying to help and not getting anywhere. So I felt a lot of times my role was to, you know, help the friend or neighbor understand at this stage in Alzheimer's disease, judgment is usually gone, and, you know, getting the person angry or agitated probably isn't going to be helpful. So I'm hoping that you had someone that was kind of coaching you and also telling you to take care of yourself, because, you know, as I said, in the situations I was dealing with, the anguish was palpable. And unfortunately, my advice at that time would not work today in the COVID environment. But one of my, the situation was that person would wander a lot outside, and I said, you know, I think you have to call 911 and, you know, have the police take them to the emergency room, and then a refusal to go home is going to, you know, precipitate some other placement arrangements. But in our situation now, I certainly wouldn't make that recommendation. So it's very hard to think, did you ever get to the point where you thought, you know, I'm just going to have to wait till there's a crisis and then she will be placed?
Well, she was brought to the hospital. It wasn't me, but one of the service agencies, because she didn't have heat. She was evaluated at a hospital, and they released her the next
To home.
Back to home. Knowing the situation, they released her back to home. And I think that she was given some emergency gallons of propane, but still they released her from home. She also did wander away from the adult daycare center a couple of times to pick up her mail, which was in the same parking lot, the post office, and she hitched a ride back to her house. She got, which was just pretty much down the street. We called the police. They went, visited her, and they said she's okay, no problems. She can stay at her home, which is where she was living at the time. So, and lots of people, I heard that, you know, their hands are tied. We can't force her to stay in the adult daycare. They finally realized that it was important that she did. But, and she has tried to wander off from the assisted living place also when she first got there. And she's very, very angry with me wouldn't talk to me. I was the enemy and was screaming and yelling and
Mhm.
my name.
Yeah.
I'll just, excuse me, remind folks that right now is just a time to offer back feedback and recommendations. So we're going to move beyond the back and forth if we can, just to make sure we hear everybody's recommendations. So no offense, this happens all the time, but that's just to make sure we get the best information out to folks. So other recommendations?
This is Ellen. I would recommend, I would recommend that everybody has a Carlotta in their lives. My goodness, this Carlotta, you did a yeoman's work to make this happen, and your persistence and tenacity is just inspiring. I wish that every patient that I have cared for had someone like you in their life, whether that be a family friend or a family member. So hats off to you for not giving up and for really kind of going at this step by step. That I think the recommendation that I have is that somebody follow your lead and really take this kind of a situation step by step, building trust, working in increments, contacting and connecting with services that are available. Just keep pushing the message that this lady really isn't safe in her home and is living in an unsafe situation, and with her incapacity was really needed to be in a safer environment. But congratulations and hats off to you for a wonderful job. And I just, boy, so I'm saluting despite the fact that you can't see me.
Thank you.
We can imagine it. We can imagine it. Thank you. Thank you, Ellen. And I'm sure we all agree with that sentiment. Really excellent. I want to just jump in to say previously I did include a link to a webinar that we hosted through the Tri-State Learning Collaborative on Aging. And in particular, this was a webinar focused on addressing the challenges of hoarding behavior. And the lead presenter was David O'Leary, who is the housing retention specialist for the Burlington Housing Authority, and he specializes in hoarding and squalor cases techniques and believes in a humanistic and compassionate foundation lies at the heart of his work. I was so very impressed with his presentation and the way they go about helping folks around hoarding issues. I don't know if he would have had any specific recommendations for engaging with someone with dementia, because he really wasn't addressing that issue. But since you have, I think, an emerging expert in your state specifically around hoarding issues, it would be great to reach out to him in future cases like that. Other recommendations?
Can you say his name again, please?
You bet. And I also did include the link in the chat, and we'll circulate it. His name is David O'Leary, and he serves as the co-coordinator of the Chittenden County Hoarding Task Force and is the housing retention specialist for the Burlington Housing Authority. Laura Gerard also presented from the Northern New England Geriatric Education Center at Dartmouth-Hitchcock, and also follows in their mechanisms in, their practices in New Hampshire.
Wow.
This is Laura Davey. Just kind of bringing the lens back out a little bit on the issue. I know one of the kind of the discussion questions is how agencies could coordinate potentially without permission. And I know that in New Hampshire, there's, communities have, service providers have wraparound conversations and create where they meet on a weekly or monthly basis. I'm sure this is common probably common across Northern New England. I think where my recommendation is to, while that is an opportunity to present cases and get feedback on. A lot of times they are like, oh, they can coordinate in a very HIPAA compliant way during those times. And I think also a recommendation is for all of our communities is to maybe, if that doesn't exist, create it. But if it does exist, we often have the same people sitting around the table, and maybe it's good to relook at who else we need to engage in these times with these really difficult situations, and like, town officials, right? To broaden the perspective and the coordination.
Very good.
I
Go
have a
ahead.
recommendation.
Yes, Cinda.
When you have difficult cases like this, and I've had lots of them over my 33-year career, I have found that the things that are most effective are persistence, determination, and when I don't know what to do, if I get stumped, I tell everybody what the issue is, and somebody always has either the solution or the next step that eventually leads me to a solution. And I think that Carlotta really epitomizes my recommendations. And I have found that persistence, determination, and just telling everybody you can think of is really been the most effective tool in dealing with these very, very difficult situations. And I'm so thrilled that I got to be a part of listening to this wonderful example of persistence, determination, and creativity from Carlotta.
Thank you, Cinda. Go ahead, Mark.
I absolutely agree with that. Persistence, navigating the bureaucracies of the guardianship programs and the various regulations that us service agencies live within. Persistence is key. I often recommend people like voting, they should contact APS early and often. That just keeping situations like this in front of people is critical. And the challenge in Vermont is that APS, well, actually it's not the challenge. I think one of the benefits in this situation is that APS punts self-neglect cases to the agencies on aging. And so I think the other recommendation is just continuing to use the networks like the community health teams, because honestly, having worked in Vermont for so many years in health agencies, I certainly respect the HIPAA regulations, but I have to say, honestly, I work around the edges. And so I'm often having conversations with people that around situations like this and trying to honor privacy, but at the same time, trying to work with people around what resources are out there and what information I can provide and networking. So I think those are all really critical pieces.
Thank you, Mark. Allegra, you have any thoughts? No? Okay. How about our friends from the Vermont or New Hampshire Alzheimer's Association, Melissa or Emily? Are you there? There she is. Can't hear you. Melissa, can't hear you. Annie, is she muted from your end?
She is not muted from our end, so I'm not sure.
Wait, can you hear me now?
There, yep.
Yeah.
Yep. Okay, hold on. Sorry, I forgot that I had to call in separately for some reason. I will probably follow up later because I had to step out and I think I probably missed a few pieces of important information. So I very much apologize. I don't know if I saw Emily on earlier.
She is.
Okay.
Sorry, can you hear me?
We can, Emily.
Okay, great.
Yeah, Emily.
Yeah. I've been listening to all of everybody else's recommendations, and I agree. I was thinking, I was looking particularly at the question of coordinating between agencies when there's just a really complex case. And at that point, I would wonder at the primary care level if there's been any sort of release. I was trying to think back to my old days of working at a health center, and where I would do a deep dive into somebody's chart to see, was there a chart or was there a release signed at any point when they became a patient here? Did they sign like a blanket release? So I know that it might be rare, but you may find those individual circumstances where there's at least just one agency that you're able to communicate with. And it can be really challenging when it's complex and there's so many pieces and moving parts. But my first initial thought would be that that'd be where I would start, is to see what may have been tried before, or if years past there was some sort of release signed.
And Molly Dugan, you want to jump in with your comment and thoughts on that?
Sure. I just know, anytime HIPAA gets brought up, there's so many different interpretations out there. And, I feel like every lawyer I've ever talked to about HIPAA has a different take on it. So I really try to reference, the law as much as I can, just looking at the language. And I know, there are these 3 exemptions to HIPAA for, healthcare folks. And I know that care coordination activities is embedded in one of those exemptions. Now, I'm not a lawyer, so I'm sure that maybe there's, some that would say that's maybe not their interpretation. But, as Mark said, I think there are situations like this where sometimes you have to make a professional judgment and document what your reasoning was.
And I would offer, I know that with difficult cases that I've worked on as an advocate, following up on APS cases, if we do team, it's, for me, what it does is, instead of always wondering what's going on with this person or that service, it really holds us accountable, like who's going to do what next, and a timeline, so that we have an idea of what's agreed upon and an idea of what's happening. So that's I was going to say earlier, teaming and working as a group in a difficult situation, that's really been powerful for my work. So thank you.
Excellent, thank you. So our time has come again to an end. Unless there's any very short other recommendations that folks feel like they need to offer, I'm just going to call on Krista, who has been taking our notes today, to summarize the recommendations. And by the way, she's also the teacher and principal for her little boy, so, bear with her.
Can you hear me?
Yes.
Yes.
Great, thank you. Okay, so the recommendations for today were getting medical providers who knew her prior, that she didn't have the capacity. It's important to do this early on. To have a physician make a house call, although not in the current circumstances. Important to have support for the caregiver helping the individual through cases like this. Getting a PCP involved via telehealth or a home visit. Have an advocate in your life, like a Carlotta, working step-by-step and trust. The webinar on hoarding that is from the Tri-State, reaching out to David O'Leary. Let's see, how the agencies can coordinate without permission, having weekly conversations and check-ins with cases like this, coordinating in a HIPAA-compliant way. Engaging new people in conversations such as town officials to broaden the scope. Tell everybody what the issue is. Persistence and determination, creative thinking is very helpful. Contact APS early and often. Continue to use networks like community health teams for networking. On a primary care level, look back in histories for anything that you could find releases signed. Use your professional judgment and document your reasoning.
That was great, Krista. Jess just emailed me and she has lost power, unfortunately. So I don't know if that's due to, but that was a great summary. I do want to remind you of our session next month. Will be The didactic will be the importance of legal planning and legal services for the elderly. And our case presentation will be Gibson Center for Senior Services. Mary Ann Jackson is the convener for that. We look forward to seeing you all again on April 23rd, hopefully not under the same circumstances of all being social distancing. But happy social distancing to you all, and have a great afternoon. If the faculty could stay on, that would be wonderful. Thank you.